The lymphatic system. You live in a world that surrounds you with chemicals and disease-causing organisms waiting for a chance to enter your body and harm you. Your body has three lines of defense mechanisms against foreign organisms: pathogens, cells, cancers, or molecules, pollutants, and allergens. Physical defense mechanisms include your skin and mucous membranes, chemicals in your perspiration, saliva, and tears, hairs in your nostrils, and cilia and mucus to protect your lungs. The physical defense mechanisms are further discussed in the individual body systems, chapter 3. Humoral defense mechanism. Base antibodies, ABs. These are found in body fluids and bind to bacteria, toxins, and extracellular viruses, tagging them for destruction. Cellular defense mechanism. Based on defensive cells, lymphocytes, these directly attack suspicious cells, like cancer cells, transplanted tissue cells, or cells infected with virus or parasites. The lymphatic system has three functions: absorbs excess interstitial fluid and returns it to the bloodstream. Remove foreign chemicals, cells, and debris from the tissues, and absorb dietary lipids from the small intestines. The lymphatic system has three components: a network of thin lymphatic capillaries and vessels, similar to blood vessels that penetrate the interstitial spaces, the spaces between tissues of nearly every tissue in the body except cartilage bone, red bone marrow, and the CNS. A group of tissues and organs that produce immune cells and lymph, a clear, colorless fluid similar to blood plasma but with a composition that varies throughout the body. It flows throughout the network of lymphatic capillaries and vessels. The lymphatic network begins with lymphatic capillaries that are closed-ended tubes nestled among blood capillary networks. The lymphatic capillaries are designed to let interstitial fluid enter so it can become lymph. In addition, bacteria, viruses, cellular debris, and traveling cancer cells can enter the lymphatic capillaries with the interstitial fluid. The lymphatic capillaries converge to form the larger lymphatic cells, collecting vessels, which resemble small veins and have one-way valves. They travel alongside veins and arteries. Live in the hood. At irregular intervals, the collecting vessels mentioned above enter the lymph nodes. There are hundreds of lymph nodes stationed all over the body. They are concentrated in neck, axilla, and groin. Their functions are to filter impurities from the lymph and alert the immune system to the presence of pathogens. The lymph moves slowly through the nodes, which filter the lymph and remove any foreign matter. Macrophages in the lymph nodes ingest and break down foreign matter and display its fragments to T cells. This alerts the immune system to the presence of an invader. The lymph leaves nodes when it enters into the efferent collecting vessel. All these lymph vessels move lymph towards the thoracic cavity. Collecting vessels merge into the lymphatic trunks that drain lymph from a major body region. These lymphatic trunks then merge into two large lymphatic ducts: the thoracic duct on the left and the right lymphatic duct, which empty the veins beneath the collarbone, the subclavian veins. In some organs, lymphocytes and other cells form dense clusters called lymphatic follicles. These are constant features in lymph nodes, the tonsils, and the ileum, a part of the small intestines. Lymphatic tissues are composed of a variety of cells that include T lymphocytes, T cells. The T stands for thymus, which is where the cells develop and mature. T lymphocytes make up 75 to 85% of body lymphocytes. B lymphocytes, B cells, these cells mature in the bone marrow. B lymphocytes make up 15 to 25% of lymphocytes. They respond to a specific antigen and become plasma cells to produce antibodies, immunoglobulins, Ig, that immunize, neutralize, and prepare the specific antigen for destruction. Macrophages that have developed from monocytes ingest and destroy antigens, tissue debris, bacteria, and other foreign matter, phagocytosis. Lymphatic organs. Spleen. The spleen is a highly vascular and spongy organ. It is the largest lymphatic organ. It is located in the upper left quadrant of the abdomen. Below the diaphragm and lateral to the kidney, the functions of the spleens are to phagocytose, consume bacteria and other foreign materials, initiate an immune response when antigens are found in the blood, phagocytose ode defective erythrocytes and platelets, serve as a reservoir for erythrocytes and platelets. Tonsils and adenoids. The tonsils are two masses of lymphatic tissue located at the entrance to the upper part of the throat, the oropharynx, that entrap inhaled and ingested pathogens. Adenoids are similar tissues on the posterior wall of the pharynx and nasopharynx. The tonsils and adenoids from lymphocytes and antibodies trap bacteria and viruses and drains them into the tonsillar lymph nodes for elimination. Both the tonsils and the adenoids can become infected. The thymus, a small organ of the immune system located at the center of the upper chest, has both endocrine and lymphatic functions. T lymphocytes develop and mature in the thymus and are released into the bloodstream. The thymus is largest in infancy and reaches its maximum size at puberty. It then shrinks and is eventually replaced by fibrous and fatty adipose tissue. Disorders of the lymphatic system. Physicians routinely feel that the accessible lymph nodes are in the neck, cervical nodes, axilla, armpit, axillary nodes, and groin, inguinal nodes, for enlargement and tenderness, which indicate disease in the tissues drained by the lymph nodes. Cancerous lymph nodes are enlarged, firm, and usually painless. Infections in the lymph nodes cause them to be swollen and tender to the touch, a condition called lymphadenitis. On lymph nodes, enlargements are collectively called lymphadenopathy. When lymph nodes are removed, the process is called lymphadenectomy. Lymphoma is a malignant growth neoplasm of the lymphatic organs, usually the lymph nodes. Associated symptoms can be fever, night sweats, fatigue, and weight loss. Lymphomas are grouped into two categories by microscopic examination of affected lymphatic tissue. Hodgkin lymphoma or Hodgkin disease. This cancer spreads in an orderly manner to adjoining lymph nodes. This enables the disease to be staged depending on how far it has spread. And non-Hodgkin lymphomas. These occur much more frequently than Hodgkin lymphomas. They include some 30 different disease entities and 10 different subtypes. Diagnostic procedures used to determine lymphoma includes a biopsy of an enlarged node, X-rays, CTs, and MRI scans, a lymphangiogram, and a bone marrow biopsy. Tonsillitis, inflammation of the tonsils and the adenoids, occur mostly in infancy and childbirth. The infection can be viral or bacterial, usually streptococcal. It produces enlarged and tender lymph nodes under the jaw. The infection can be recurrent, and a tonsillectomy is sometimes performed. If the adenoids also show recurrent infection, an adenoidectomy can be performed, often at the same time as the tonsillectomy. Splenomegaly, an enlarged spleen, is not enlarged in itself but the result of an underlying disorder. But when the spleen enlarges, it traps and stores an excessive number of blood cells and platelets, hypersplenism, reducing the number of blood cells and platelets in the bloodstreams. Occasionally, a splenectomy is necessary. Ruptured spleen is a common complication from car accidents or other trauma when the abdomen and ribcage are damaged. Intra-abdominal bleeding from the ruptured spleen can be excessive, with a dramatic fall in blood pressure. It is considered a surgical emergency requiring splenectomy. Lymphedema is localized, brawny, does not easily pit on the finger pressure. Minimally pitting fluid retention is caused by a compromised lymphatic system, often after surgery or radiation therapy. It can be primary where the cause is unknown. The immune system. Case report 7.5. A laboratory technician working the night shift at Forward Medical Center. Mr. Michael Cohen, a 40-year-old homeless man and drug addict who has presented to the emergency department with a high fever with no obvious causes. You have been called to the emergency room to take blood from Mr. Cohen. You insert the needle in an antecubital vein, but he starts jerking his arm around and tries to get off the gurney. In the struggle, the needle comes out of the vein and pricks your hand through your glove. You immediately flush and clean your wounds, report the incident, seek immediate medical attention, and go through your initial medical evaluation. However, because of your possible exposure to Cohen's blood, it is essential that you have knowledge about your own immune system and its response to potential infection. This will help you make informed decisions about your treatment and future employment. The immune system. The immune system is a group of specialized cells in different parts of the body that recognizes and neutralizes foreign substance. It is the third line of defense listed earlier in this chapter. When the immune system is weak, it allows pathogens, including the viruses that cause common colds and flus and cancer cells, to successfully invade the body. Three characteristics distinguish immunity from the first two lines of defense of physical and cellular mechanisms. Specificity. The immune response is directed against a specific pathogen. Immunity to one pathogen does not grant immunity to another. Specificity has one disadvantage. If a virus or bacterium changes a component of its genetic code, it then becomes a new organism to the immune system. This mutation occurs, for example, with bacteria in response to antibiotics and in HIV's response to anti-HIV drugs. Development of resistance. When exposure to the same pathogens occurs again, the immune system recognizes the pathogen and has its responses ready to act quickly. Discrimination. The immune system learns to recognize agents, antigens that represent self, and antigens that are non-self, foreign. Most of this recognition is developed prior to birth. A variety of disorders occur when the discrimination breaks down. They are known as autoimmune disorders. An antigen is a molecule that triggers an immune response. Most antigens are unique in their structure. It is this uniqueness that enables your body to distinguish its own self molecules from foreign non-self molecules. Immunity is the state of being able to resist a specific infectious disease. It is classified biologically into two types, although these often respond to the same antigen. Cellular, cell-mediated immunity. This is a direct form of defense based on the actions of lymphocytes to attack foreign and diseased cells and destroy them. The many types of T cells, B cells, and macrophages described in the previous lessons of this chapter are involved in the style of attack. Humoral antibody-mediated immunity. This is a direct form of attack that enjoys antibodies produced by plasma cells, which have been developed from B cells. These antibodies bind to an antigen and tag it for destruction. These antibodies are called immunoglobulins, present in blood plasma and body secretions. Complement fixation. The complement system is a group of 20 or more proteins continually present in blood plasma. Immunoglobulins bind to foreign cells, initiating in the binding of complement to the cell and leading to its destruction. Immunization. Immunization is a preventive method of stimulating the immune system without exposing the body to an infection. An agent vaccine composed of antigenic components of a killed or attenuated microorganism or its inactivated toxin is injected into the body. Vaccination is a crucial step in keeping our population healthy. For example, vaccination has eradicated smallpox worldwide. However, if we stop vaccination against smallpox, or our population will be susceptible to smallpox outbreaks. The same concept applies to disease and childhood immunization. Disorders of the immune system. The immune system is prone to very serious disorders, from allergic reactions to life-threatening infections. Hypersensitivity is an excessive immune response to an antigen that would normally be tolerated. In most allergic hypersensitivity reactions, allergens, antigens stimulate the cells to produce histamine. The symptoms produced by these changes include edema, mucus hypersecretion and congestion, watery eyes and hives, urticaria. Hypersensitivity includes allergies, reactions to environmental agents like pollens, molds, dust, foods, and drugs. Autoimmune disorders, abnormal reactions to your own tissues. Alloimmune disorders, reactions to tissues transplanted from another person. Anaphylaxis is an acute, immediate, and severe allergic reaction which can be relieved by antihistamines. Anaphylactic shock is more severe and is characterized by difficulty in breathing, dyspnea due to bronchial constriction, circulatory shock, and even death. It is a life-threatening medical emergency. Asthma is triggered by allergens listed above and by air pollutants, drugs, and emotions. Bronchioles constrict spasmodically bronchospasms, leading to the wheezing and coughing of asthma. Autoimmune disorders are an over-vigorous response of the immune system. Here, the immune system fails to distinguish self-antigens from foreign antigens. These self-antigens produce autoantibodies that attack the body's own tissues. This type of response cures, for example, in lupus, erythematosus, type 1 diabetes, multiple sclerosis, rheumatoid arthritis, and for psoriasis. Immunodeficiency disorders are a deficient response of the immune system where it fails to respond vigorously enough. These disorders are classified into three categories. Congenital inborn disorders are caused by genetic abnormality that is often sex-linked, with boys affected more than girls. An example is inherited combined immunodeficiency disease, a characterization by an absence of both T cells and B cells. These children are very susceptible to opportunistic infections and must live in the protective sterile enclosure. Immunosuppression is a common side effect of corticosteroids used in treatment to prevent transplant rejections and in chemotherapy treatments for cancer. Acquired immunodeficiency results from diseases like acquired immunodeficiency syndrome, AIDS, which involves a severely depressed immune system from infection with the human immunodeficiency virus, HIV. HIV and AIDS. HIV is one of the groups of viruses known as retroviruses. Like other viruses, it can replicate only inside a living host cell and evade helper T cells in the upper respiratory tract and CNS. Inside the cell, the virus can stay dormant for months or years. When it is activated, AIDS, the new virus emerges from the dying host cell and attacks more cells. This dormant phase, incubation, can range from a few months to 12 years. As the virus destroys more and more cells, the body cannot produce antibodies. Symptoms appear, including chills, fever, night sweats, fatigue, weight loss, and lymphadenitis. Opportunistic infections by bacteria, viruses, and fungi can occur. These infections include toxoplasmosis, pneumocystitis, tuberculosis, herpes simplex, cytomegalovirus, and candidiasis. Cancers can also invade a form of skin cancer called Kaposi sarcoma. HIV survives poorly outside the human body. It is destroyed by laundering, dishwashing, chlorination, and the use of disinfectants, alcohol, germicidal skin cleansers. Microorganisms are everywhere in the air, water, and soil, and all over our bodies. What are they called? Normal flora. These normal microorganisms are found on your skin, in your nose and respiratory tract, and in your mouth and digestive tract. Your brain and cardiovascular system, however, are micro-free sterile. If microorganisms other than the normal flora invade the body, they become pathogens, which cause an infection. Pathogens include bacteria, viruses, fungi, and parasites. If the infection harms the body, it creates an infectious disease. Bacterial, viral, fungal, and parasitic infections are all caused by pathogens. Bacterial infections. Thousands of different bacteria can cause infections. Bacteria are single-celled microorganisms that reproduce by dividing. Frequently seen bacteria include Staphylococcus staph, which can be harmless when present on the skin surface, but causes infections in wounds or other normally sterile places like a joint or the peritoneum. Streptococcus, which is a cause of sore throats. Pneumococcus, which is a cause of pneumonia, and coliform bacteria that normally live in the GI tract but cause infections elsewhere, such as the urinary tract. In addition, methicillin-resistant Staphylococcus aureus (MRSA) is a type of bacteria that is resistant to the antibiotics normally used to treat staph infections. MRSA infections occur most frequently in hospitals, nosocomial infection, but are now being seen in community healthcare facilities as community-associated MRSA, CA-MRSA. Clostridium difficile, C. diff, infection is a growing problem in healthcare facilities, and the infection kills 14,000 people in America alone each year. When broad-spectrum antibodies such as clindamycin have destroyed normal gut flora. C. diff can take over the gut and release toxins, causing severe diarrhea and abdominal pain that can be difficult to treat and can be life-threatening or fatal. Carbapenem-resistant enterobacteriaceae, CRE, as lethal superbug occurring in American hospitals and responsible for about 9,300 infections and 600 deaths every year. The antibiotic carbapenem is considered a last resort for antibiotic for bacteria that have not responded to other antibiotics. In several cases, the CRE has been found in duodenoscopes, the complex design of which makes them difficult to clean and sterilize. Viral infections. Viruses are the smallest of the microorganisms. They cannot be seen under any ordinary light microscopes, but are visible through electron microscopes. Viruses spread from person to person through coughs, sneezes, and unwashed hands. Viruses cause specific childhood diseases like measles, rubella, German measles, rubella, chickenpox, varicella, and mumps. They cause upper respiratory infections, including modern respiratory infections like severe acute respiratory syndrome, SARS, avian influenza, bird flu, and West Nile virus. West Nile is a seasonal epidemic in North America that flares up in the summer and fall. Fungal infections. Many fungi are good fungi. For example, the mushrooms that you eat and the yeast that ferments beer and bread. Yay! Penicillin is derived from a fungus. The most common pathogenic fungus are those that cause skin infections. Opportunistic fungi are normally harmless, but like their name, they pounce on any opportunity to cause disease. People who are prolonged doses of antibiotics, are receiving chemotherapy or immunosuppressive therapy, have diabetes, mellitus, or AIDS are especially susceptible. Parasitic infections. Parasites are organisms that live on another organism and steal nourishment from their hosts. In many rural areas of the world, parasites are endemic. Malaria is caused by a parasite that is transmitted from person to person by a single mosquito bite. Pinworms are the most common parasite in America. Pinworm eggs are introduced in the body through the mouth and hatch in the intestines. The young worms migrate to the anus, where the female deposits her egg. The eggs can be transferred unknowingly by the fingers from the anus or from the infected bedding to the mouth of the same child or to another child. Hope you enjoyed this chapter, folks, and I hope you enjoyed my cat in the background causing a bunch of problems. Oh, Pearl. Yes. Anybody need a cat?